let's take a closer look at these medications to figure out why and how these might show up on the NCLEX. First up is Sucralfate, and Sucralfate works by adhering to gastric ulcers, forming a short-term protective barrier. This is like a jelly band-aid for the inside of the stomach. It shields those ulcers from gastric acid. Now, the NCLEX is likely to ask you about two things related to this medication. And the first is that timing is really important. That is because Sucralfate can only offer temporary protection. So we need this medication in place before clients start eating, which is why we want to give it 1 hour before meals and at bedtime to protect the stomach overnight when it's empty. The second thing we need to know is that we need to separate Sucralfate from other medications by at least 2 hours. And this makes sense if we think about it. If we're coating the inside of the stomach with this sticky jelly-like band-aid, it's going to interfere with the absorption of other medications. So we want to separate it by at least 2 hours to avoid any interactions. And our last medication is Misoprostol. Now, Misoprostol works in two ways. It decreases gastric acid production and increases mucus production. So it does a really good job of protecting that stomach lining, which is why it's often given to clients who are at high risk for ulcers, like those who are hospitalized or those who are taking long-term NSAID therapy. Now, if the NCLEX does ask you about Misoprostol, it is likely going to ask you about one big key safety issue, and that is that it is contraindicated in pregnancy. This is because Misoprostol can cause uterine contractions. And if we cause uterine contractions in a client who is pregnant, we're going to significantly increase the risk for miscarriage and preterm labor. So we never want to give this to pregnant clients.